So Tracy, we just talked about how the WHI study showed a 24% increase in breast cancer, which is absolutely not
frightening.
Yeah, frightening and not real, right? The data has shown that,
right.
Absolute risk versus relative risk wasn't taken into account. And plus, we also looked at the study that they did was flawed from a design standpoint.
Yeah.
So if knowing this info, if a patient came to you and said, hey, I read about this and it shows that if you go on hormones, you can get breast cancer. How do you talk to that patient? What do you walk them through?
So the first thing that I do is I explain what type of hormones are we using, how are we using them. So we're using bioidentical compounded hormones. We're using them in my menopausal patients on the skin. We're not doing anything oral. We're using our estrogen and progesterone in a cream on the skin. So it's not going into our bloodstream. It's not going through our liver. Because we're using it that way and we're testing in saliva, which is the tissues, reflects the tissue levels that are in the body, we use a very, very low dose. It is a fraction of the dose that they're giving, probably about a third of the dose of what would be given in an oral estrogen. So it's a very low dose. We're testing in actual tissues and looking at what the levels are. We always balance progesterone and estrogen. So I always have a ratio of progesterone to estrogen greater than 100. That is what's going to balance it and minimize any type of cancer effect. So low dosing, bioidentical hormones, testing every year, when first starting, testing even more than that, and taking into account the overall health of the patient. I'm going to step out for a minute and give you my personal story of how I chose to do hormones, because I have an incredibly strong family history of breast cancer on my paternal side. My grandmother, my aunt, my first cousin, and my aunt and first cousin in their 50s passed away from breast cancer. So strong family history. And it wasn't, the few genetic markers we knew back then. So we're talking 2013, 2014. That's when I went and did my wellness fellowship. Well, it just so happened that it coincided with my own personal menopause. So I'm now learning wellness medicine and I'm learning hormones. And, you come into it with what you've been taught in medical school, but I've got an open mind now and I really, really am digging in. And it turns out that the first real things that we sunk our teeth into were hormones. And I've got a family history, but I'm learning and I'm seeing the studies and they're presenting the data and they're talking about cognitive decline and bone health. And we all, as an anesthesiologist, I know the statistics. If an elderly woman breaks her hip, there is a 50% mortality and a 95% morbidity, meaning you will only 5% get back to the quality of life they had to begin with. With the morbidity and mortality. So mortality, that is going to shorten her lifespan. She is half of those women, you will be able to directly correlate that hip fracture to death. And so when I talk about morbidity, is getting your mobility back, quality of life, daily living, what could you do before, what can you not do now, those sorts of things. So that's just bone health.
Yeah, and basically where that all correlates to hormones is that if you had a small fall, right, you shouldn't be breaking your hips.
You should not.
Because your bones should be strong enough to withstand that shock absorption, right?
Exactly.
So because hormones are deteriorating and they're not treated during menopause or perimenopause,
right,
their bones are so brittle, it breaks faster.
Osteoporosis, and they're more at risk.
Yeah.
And there's a sort of, estrogen is not the only thing that we need for bone. Estrogen maintains bone density and protects against osteoporosis. Progesterone actually helps build bone, and testosterone helps strengthen bone. The sort of guru of women's hormones, she would say it's a symphony of hormones.
I love that.
A symphony of hormones. They all need to be working together, and so well-balanced hormone. And that's why I think, honestly, women's health has lagged so far behind men's health. I think that part of it is the complexity of women's health. It's not just a single hormone, it's multiple. Part of it is the complexity. Menopause is not a one-size-fits-all. It's different for everybody. We're now realizing there's a perimenopausal period that, for some people it's a short amount of time, but generally it's years leading up to menopause where hormones are becoming imbalanced and dropping. And so I think partly you had the people, it was easier to look at men's health and testosterone because it was a one size. It's testosterone. Drug pharmacy, your insurance covered testosterone, but they didn't want to cover women's hormones. And so there's so many factors that go into it.